Workers from the biggest nursing home operator in the state hit the picket line today for a one-day strike. It's all part of the battle between healthcare union SEIU and Ciena Healthcare, and they're debating over those terms of a new contract.
Yeah, employees at 5 facilities showed their willingness to fight, and Victor Williams was there from the beginning. He has more on what these employees have to say.
What do they want? Better contracts? When do they want it? Exactly right now. That's all we've been hearing from workers who decided to walk out of the job straight onto the picket lines. At 6 a.m., it was clear that nursing home employees working under the Ciena Healthcare umbrella had had enough, leaving the job on Tuesday morning to make their voices heard through the form of protest, demanding higher wages and better resources to care for patients.
No back pay, no peace.
We're treated unfair in here. We break our backs in here. We're in pain constantly every day just to get a little payment.
Over 300 workers in total were doing the exact same thing at 5 Ciena Healthcare locations all across Metro Detroit. Looking on, U.S. Senator Stephanie Chang.
They're fighting for a fair contract, better pay, and not rolling back vacation days, which I think is a really common sense ask during this time where we need to make sure that people are getting the care that they need.
Another concern is what employees believe to be inadequate staffing, resulting in the patients being put at a disadvantage.
They refuse to give the residents the proper care that they need by us being short-staffed. 16 patients on day shift. You cannot possibly get the work done that they need.
The CEO of Ciena Healthcare, David Parker, says they are working on finding an agreement with the following statement, which reads, quote, "The planned strike is diverting attention away from the bargaining to resolve the few remaining open issues in each agreement, and we look forward to working with the union to obtain favorable contracts for our employees," end quote. But some employees are saying that that's not good enough.
He doesn't care. He's at home. He's doing whatever he's doing while we in here slaving with our extended family. He doesn't care about anything going on here. All he cares about is being greed. Money, money, money.
We should make sure that the workers who provide that care are getting treated fairly.
And at this point, we're not sure where negotiations stand, but the hope is that some common ground can be found soon, so it's not the residents who are left with the short end of the stick. On the east side, Victor Williams, Local 4.
Now, in a statement sent to Local 4, SEIU Healthcare says, in part, Ciena's communication to the public and the press is disingenuous at best. These facilities see 40 to 60% turnover every year, and the care suffers as a result. It goes on to say SEIU HCMI is proposing contracts that recruit and retain staff to provide the kind of care that the residents of these facilities deserve.